Hi, hello everyone. I'm audible and visible. Audible, visible. So good evening, all of you. How is your preparation going on? How is your preparation going on? Molly, Harish, yes. Okay. So yes, Manthan, how is your preparation going on? Manthan and Dishantel, how is your preparation going on? All of you, just say hi, hello in the group. Hi, hello in the chat box. Hi, hello in the chat box. So let's start in 1 or 2 minutes. So Manthan, Neha, Dishant, Shreyas, Molly, Harish, yes. Okay. So let's start now. So to begin with, so last 24 hours, so 3 hours for your upcoming exam, first year exam. Don't stress, do your best, forget the rest. Don't stress, do your best and forget the rest. Be confident and be confident. So with this now we are going to start. So the 10 important clinical question that can be asked in your upcoming exam. This is the first question of today's discussion. A 30-year-old patient, the patient age is 30-year-old, who sat with the arm hanging by the side of a chair, history of inability to extend the hand at the wrist joint. So is having inability of extension of the wrist joint. So like this, you can see that. So 30-year-old patient. So and what is the probable diagnosis and what is the probable nerve involved? So this is asked once in the exam. So once in your RGUHS exam, what is this condition basically? It is having inability to extend the wrist In some question they can give inability to extend the elbow as well. The questions are basically name the nerve compressed in this condition. So what is the nerve that is compressed in this condition? Mention the site of compression of nerve. So what is the site of compression of that nerve? Enumerate the branches of nerve given here. So this is one typical question asked many times in your RGUHS exam. Yes, come on guys, come on. Yes, can anyone answer? Can anyone answer this question? So this is, I'm giving you clue. This is also known as Saturday night palsy. Okay, Saturday night palsy. Night palsy. Night palsy. Also known as crutch palsy. Crutch palsy. And one more name given to this is, and very funny name, that is known as honeymoon palsy. So honeymoon palsy. Palsy. Okay. So there are three names for this. What is this condition? Can anyone answer? What is the condition probably? Yes, very good. Bhima answers a radial now. Arvind answered radial now. Yes, very good. Very good, all of you. Congratulations. Very good. So what is the site of involvement? That is axilla. Very good. So some student answered, sir, this is the axilla. So axilla is the site, or it can be spiral groove. So it can be spiral groove of the humerus. So here it is axilla is the correct answer. So this is classical Saturday night palsy. Saturday night palsy. Okay. Yes, good. So you can write about the radial now, the origin, the branches, and applied anatomy. Okay, fine. Yes, already I discussed. So radial nerve palsy known as Saturday night palsy, known as honeymoon palsy, known as crutch palsy. So anything can be given in your exam. Fine. So next, so this is what the thing we discussed. Yes. So what are the sites of lesions of radial nerve? One in the axilla, one in the spiral groove. Yes. Okay. Can anyone tell me what are the muscles supplied by radial nerve? What are the muscles supplied by radial nerve? Yes, come on guys. What are the muscles supplied by radial nerve? Yes, yes, come on, try all of you. What is the muscle that is supplied by radial nerve? There is a mnemonic to remember the muscle supplied by radial nerve. This is very important MCQ in RGUHS exam. So all of you, come on, try Spurti. So submandibular salivary gland, sublingual salivary gland, mucinous gland, and parotid gland. That is important actually. You must know at least some histology of these glands. So triceps, okay, triceps, good. Bhima, very good. He answers are triceps. So there is a mnemonic for that. You must be knowing the mnemonic is beast. So mnemonic is beast. So B for brachioradialis. E for extensors. E for extensors. And A for Anconius. And S for supinator. And T for triceps. So the mnemonic is beast. So easy, you are compressing my radial now. He is the beast. Okay, just remember beast. So all of you write in the chat box beast. So write in the chat box beast. Beast. Write in the chat box. Keep writing, guys. Keep writing. So brachioradialis, all the extensors, Anconius, supinator, and triceps. Mnemonic is beast. Whenever question asks radial now, so it is from the radial now is from the posterior card of the brachial flexus. So it can lead to wrist drop. So right. So the muscle supplied basically mnemonic is beast. All of you write the beast. Keep writing beast. Just write beast. Very interesting mnemonic, beast. Okay, so this is about the one very important clinical question asked repeatedly in the exam. So radial nerve. So three important nerves in upper limb very commonly asked. One is the median nerve, 5 marks question ulnar nerve, and also the radial nerve and the brachial flexus. Sometime in one of the exam the question asked about the anterior introitious nerve and posterior introitious nerve. Remember, anterior introitious nerve is a branch of that is the median now. Postintocious now is a branch of radial now. So both are related only. So yes. In the chat box. Hello, right. Beast, Manthan, keep writing. Purti, Dishant लिखो, बीस्ट लिखो. सो इंटरेस्टिंग है, बहुत इंटरेस्टिंग है. आपको थोड़ा पढ़ना ही पड़ेगा, आपको लिखना ही पड़ेगा. ठीक है. यस, कम ऑन. Okay, Manthan, fine. Keep writing, guys. So the last 24 hours. So remember this 24 hours, there will be a lot of anxiety. So the positive mindset is very important at this stage. So be positive. Don't worry about anything. Don't worry about the percentage. Don't worry about your classmates. Don't worry about the less internal marks and all. So just concentrate on your notes, revise, revise. So go inside the examination hall with the positive mindset. So what is important now is a positive mindset. I'm telling you, all of you, you can win any war, you can win any match, you can win any exam with the positive mindset. Remember, positive mindset is very, very important, guys. Be positive, be positive, be positive. Okay, beast. Okay, good. चलो, ये हो गया. Arvind Chavan, Manthan, okay, Bima, okay, fine, okay, Bima, I'll try you, don't worry. Chalo, next clinical question. So next clinical question. So this is, I think, very simple question. 55-year-old male was brought to emergency with a history of road traffic accident. So history of road traffic accident. So there is a injury to the cervical spine. He was diagnosed with C4, C5 fracture. Mention the nerve involved. So mention the nerve involved. So this is very, very important question, and this is the question related to diaphragm. Okay, what is this? Can anyone? Shashank Pujar, what is this condition? Asked in RGUHS clinical based question in your previous year paper. What is this condition? So this is basically involvement of phrenic nerve. Okay? Phrenic nerve. The root value of phrenic nerve C3, C4, C5. So 3, C4, C5 keeps you alive. You are alive. So you are alive. You are alive because of your phrenic nerve. Phrenic nerve is C3, C4, C5, which is very important muscle of inspiration. Okay. So yes, phrenic nerve. Very good. Very good. Many answering. That's great. Now, so one very, very important question. All of you concentrate. So that is openings of diaphragm. Openings of diaphragm, the level of diaphragm, and what are the structures passing through it. Can anyone tell me what are the 3 openings in the diaphragm? So diaphragm, chat box. Okay, opening, that is okay, T8, right? So these are all openings. As you know, there is a vena cava opening at the level of T8. So infra vena cava, right phrenic now. Okay, remember it is present on the right side. Remember, right phrenic now. Esophagus 0 is there. Eso, that is O, is there. So T10 basically. So esophagus, vagus now, esophageal branch of left gastric artery. Aortic opening T12 and aorta, thoracic duct, aegagus vein. Very, very important. So important, guys. Very commonly asked in the exam. This is important. Asked more than 5 times. More than 5 times. So vena cava, aortic and esophageal. Very good. Arvind. So Arvind, very good answer. Arvind. And before that, I think Bhima also answered. So Arvind, great. So Arvind and Bhima both are answering great. Yes, good. Chalo. So this is second clinical question about the phrenic now. Let's see what is the third clinical question. Third clinical question. The clinical question. This is all of you again very confusing, and this is asked more than 5 times in RGUHS. So very, very important concept. So this question, what is this question basically? 28-year-old female. So female hai or complaints of pain and numbness in the thenar eminence. So the patient is having at the thenar eminence. All of you, thenar eminence, not hypothenar, thenar eminence. So thenar eminence and of the right palm, name the nerve affected in this condition. So, and what is the distribution of this nerve? What is this? Spurti, Arvind, Bhima. What is this condition? So, patient again is a 28-year-old. Patient is having a weakness in the thinner eminence. Sometimes there can be paralysis or the atrophy of the thinner muscles. So, what is this condition basically? Yes, can anyone answer? What is the condition? Yes, median now. Very good. Bhima answered. So, median now. The condition is known as carpal tunnel syndrome. Okay. So, carpal tunnel syndrome. Carpal tunnel syndrome. And the nerve involved is median now. Commonly involved. It's very important MCQ as well. So, what is the nerve involved in carpal tunnel syndrome? Your answer must be that is basically median now. Median now, that is the answer. Yes, median now is affected. Yes, very good. Good. Chalo. So let's see what are the and one more very important MCQ. What are the muscles supplied by median now? What are the hand muscles which are supplied by median now? Can anyone answer? What are the hand muscles supplied by median now? Yes, Roshan. Roshan, okay, fine. What are the hand muscles supplied by median now? Very, very important concept. Very important concept, guys. So the concept is very simple. So this is actually the thenar eminence, which is atrophied here. This is carpal tunnel syndrome. And what are the muscles? Remember, mnemonic is loaf. Loaf is the mnemonic. Very important one. All of you concentrate. Loaf. Loaf, not loafer. Loaf. So L for lateral two lumbricals. Lateral two lumbricals. O for opponens pollicis. O for opponens pollicis. And adductor pollicis brevis. Flexure pollicis brevis. So mnemonic is loaf. So all of you write in the chat box, median now is equal to loaf. Or we can remember. So median now is equal to loaf. All of you write in the chat box. One time writing is equal to 10 time reading. Keep writing in the chat box. Keep writing. गुड, चलो ये आपको लिखना पड़ेगा लोफ. ठीक है. नाउ what are the deformities in case of median now abnormality? What are deformities in median now abnormalities? So just remember, all of you, there are three important questions. One is ape thumb deformity. Ape thumb deformity. Ape thumb deformity. Very important concept. The second one is carpal tunnel syndrome. Third one, that is benediction attitude. Benediction attitude. Three things are very common. So all of you remember ape thumb deformity, benediction attitude, and also that is carpal tunnel syndrome. Very, very commonly asked in the exam. Loaf, Manthan, okay, Salman Akhtar, that is great. That's great. Okay. So now can you identify what is this condition? This condition, guys. What is this condition? There is a very interesting image there. So what is this condition? Look at this. In case of median now, there is a deformity which is known as something related to ape thumb deformity. Okay. So all of you, what is this basically? What deformity? What deformity is common? Basically, deformity is known as ape thumb deformity. Ape thumb deformity is very common. Second deformity. So this is, can anyone identify what is this deformity? So the patient is unable to extend his index finger and a middle finger like this. Index finger and middle finger. What is this condition known as? What is this condition known as? Yes, Bhima, this is aptum. You answered correctly. Now, what is the next one? Next one. What is this basically? Like this. Shooting sign? No, it is not shooting sign. Okay, shooting sign? No. बताओ क्या है? Claw hand. This is not claw hand. This is one. What is this actually? This is like this. Extension. Extension is not possible. Extension is not possible. What is this? Claw hand. Claw hand नहीं है. This is known as benediction attitude. So, attitude. Pass by. Okay, good. Okay. Okay. Now, this is very simple question, guys. On examination after childbirth, a case of forceps delivery. Forceps delivery. So, the newborn baby left upper extremity is notable. So, for arm adduction, the arm is adducted, elbow is extended, and forearm is pronated. So, what is this condition? What is this condition? Milan R, very good. Milan, okay, good. So, what is this condition? Fourth important clinical scenario. And pronated because of the inability of pronation, supination basically. Yes, very good. So, this is C5, C6. That is Arup paralysis. What are the nerves affected in this? What are the nerves affected in this? Let's see who is going to answer. What are the nerves affected in case of Arup palsy? What are nerves? Okay, Arvind Chavan, okay. Bhima, that's fine. Bhima, that's fine. What are nerve affected? So, one now. So, the very simple now, that is the axillary now. Axillary now. And the second now is musculocutaneous now, MCN. One more nerve is there. What is this one more now? The answer I wanted is this third now. Let's see who is going to answer. Upper trunk nerves. What upper trunk nerves? One more now. Axillary okay. Musculocutaneous nerve is okay. One more now. Chavan, I need answer. I need answer from you. So, two already over, axillary and MCN. एक और बताओ कौन सा है? एक और. Basically, you can see there are three nerves commonly affected. So, one is axillary nerve. You can see there axillary nerve, musculocutaneous nerve, and suprascapular nerve. Again, this is MCQ in exam. Your exam. Okay. Yes. Chalo. F palsy, Klumpke paralysis. Okay. Then the fifth question is from thorax. One more very important concept, very important concept in MI. So, the cardiac pain due to angina pectoris. So, angina pectoris means that is because of partial occlusion of the coronary artery, there can be pain over the precordium, angina pectoris. So, the pain usually referred to left precordium and medial aspect of the left arm. So, the pain goes to the medial aspect of the left arm and the medial aspect of the left forearm. So, why? What is the anatomical basis? Very simple question. What is the anatomical basis and what is the root value of that? What is the root value of that? As you said, it is basically the referred pain, right? Referred pain, the root value of this. Prognosis of coronary disease. Prognosis like angina pectoris, MI, that is better in old age than young age. So, heart attack in old age, so that has better prognosis than heart attack in young age. Like example, a 60-year-old heart attack has better prognosis than heart attack in the age of 40, 35, 40 like Puneet Rajkumar death. Why? So, that is the question asked in the exam. So, that is the question asked. T10. So, Arvind Chavan is telling T10. नहीं है बेटा, T10 नहीं है, T10 नहीं है ये. What is the dermatome value? Why? Can anyone answer second question? Second question. Yeah. So the root value, that is basically T1 to T4. So that is what you need to write. So all of you write in the chat box. T1 to T4 is equal to pain. Write in the chat box. T1 to T4, that is cardiac pain. So it is not T10, T1 to T4. So write this in chat box, all of you. Write this in chat box. So keep writing. Now, second question is there, very interesting question. Prognosis of coronary disease is worst in young age than old age. Why? Why? Arvind Chavan, Bhima, Salman Afar, Milan R, Manthan, Shashank Pujar. Yes, can you answer? Neha, Dishant L, Shreyas Mali, Harish S. Is it okay? Why? T1 to T4 is equal to cardiac pain. Very good, Rahman. So my question is simple. Why prognosis is better in old age? Remember why? Because in old age, so there is a opening of anastomosis. So there is a functional anastomosis that opens in the old age. And the second thing, there is a more collateral circulation. So what is the word you need to write in the exam? There is an increased collateral circulation and there is opening of anastomosis. That's why heart attack in old age has better prognosis than the heart attack in young age. Very, very important concept. So Manthan, you getting my point? Manthan, you got it? So this word you need to write in exam. So the word required, prognosis of coronary artery disease is better than in old age. So that is because of increased anastomosis and collateral channels that develops in old age. So this is the word you need to write in the exam. And I said already, cardiac pain is T1 to T4, that is upper thoracic spinal segments. Pain. Is it clear? Are you getting my point? Are you getting my point? Yes, very good, Sayed. Excellent, good answer. Good. Rahman is very, attentive in all the classes. That's great. Now here I need to teach you one more important concept. So that is your coronary sinus. So coronary sinus, very commonly asked. Coronary sinus. So what are the tributaries of coronary sinus? So the mnemonic is there. The mnemonic is MOX. Just remember the mnemonic MOX. MOX is there. So here is the mnemonic MOX, coronary sinus. M for middle cardiac vein. And small cardiac vein. So great cardiac vein, small cardiac vein and middle cardiac vein, oblique vein of the left atrium. So just write in the chat box, coronary sinus is equal to MOX. Very important, guys. Very, very important. Every question matters. Every question matters. Every information matters. So आपको लिखना है मॉक्स, लिखना है मॉक्स. ठीक है? Mock. Chal. Next comes is your next few questions. 5 questions over, I think. Sixth question. Okay, sixth question. Can anyone answer? Felt moderate pain. Having moderate pain in the left shoulder, or so right shoulder for the past 2 weeks. The pain was so severe to prevent from the bowling. So he is unable to do the bowling like this. Okay. He is not able to do the bowling like this. Okay, he is having difficulty in the movements of the shoulder. Okay, he is unable to bowl. He must be a cricketer, right? Then, so he visited a sports medicine specialist, and they felt the maximum pain was felt at the mid range of abduction. So the maximum pain occurs in the mid range of abduction. What is this condition known as? Yes, Bhima, very good. So Bhima is answering, sir, this is basically a condition known as rotator cuff injury. Very good. Rotator cuff tendinitis. Tendinitis. Bhima. Very good, Bhima. Helping others and helping me. So remember, rotator cuff made up of 4 muscles. The mnemonic is sits. So SITS, sits. As for supraspinatus, infraspinatus is minor. Remember, not major. T is minor. Major नहीं है, minor. Or subscapularis. And a brilliant student, a topper in the batch, is going to write the action of these muscles as well. So what supraspinatus will do? Abduction, you know, and all this you need to write in the exam. Okay, so you need to write about basically sits and also the action. Okay. So and very important guys, shoulder joint. शोल्डर जॉइंट आपको मग करना ही पड़ेगा, आपको लिखना पड़ेगा फ्लेक्शन इज काज्ड बाय, सो दिस इज फ्लेक्शन, so this is flexion, this is extension, so this is abduction, so this is adduction, so and this is interrotation and extrarotation, interrotation, extrarotation, then circumduction. You must know. Okay, all of you guys, have you read all the movements and the muscles? Manthan, Salman, Syed, Bhima, आपको याद है क्या? आपको याद है क्या? All these muscles. So muscles of flexion, so muscles of extension, abduction, adduction, interrotation, extrarotation, circumduction. Bhima, you must go through the muscles, guys. Very important concept. Very important concept. Chalo. Okay, Manthan, very good. Syed, tell me, abduction is caused by. Initiation of abduction caused by 90-degree, caused by overhead abduction, caused by overhead abduction like this. Overhead abduction. ठीक है? Bhima, abduction ಏನೇನು ಮಾಡುತ್ತೆ? Abduction ಯಾವ್ದು ಮಾಡುತ್ತೆ? So this is abduction, initiation, 90-degree and overhead abduction like this. Alva? So can anyone tell me? Okay, Bhima. Chalo. Fine. Okay, so you must know all the muscles and the movements. Okay, that's fine. So this is about the 6th question. 7th question, yesterday we discussed Parkinson disease. We discussed yesterday. There will be a question. Cerebellar disease, Danish palsy, human and LMN, down and out high. Yesterday we discussed. Can anyone tell me down and out high? What is the nerve involved? Yes, deltoid, supraspinatus, overhead abduction. Okay, Jnanesh is telling, sir, lateral medial fibers. Okay, that's fine. So yes, fine. And overhead abduction. Which muscle? Trapezius, anterior. Jnanesh, good. Down and out high. This is the question. Down and out high. Down. So example, this is eye. Down and out high. So down here and out. Down and out. Okay. So this is normal. Normal hai. Down and out. What is this? Oculomotor nerve palsy? Yes, very good. Third nerve palsy. Good answer. Good. So this is about the 10 important questions in paper 1. So we'll come up with important question of paper 2 day after tomorrow, after your paper 1 exam. Okay. Okay, fine. Chalo. So one clinical scenario here, one more clinical scenario. Just go through this, identify what is this condition. What is this condition? Medical condition, very commonly asked. Look at this patient. The patient is having proptosis. Patient is having pain. There will be exophthalmos. Sometimes there will be bilateral involvement. So this is one very serious condition and very commonly asked in the exam. So what is this? Malini? Yes, Malini is answering now. So Malini is telling, very good, sir. This is cavernous sinus thrombosis. Excellent, excellent answer. Malini, very good. So treatment, the treatment requires high antibiotics and analgesics. So this is the treatment after 3 months. So after 3 months, so she is normal. Okay, she is normal. So swelling is decreased, everything is normal. So this completes your all 10 questions along with one video based question. So in around 30 minutes as usual. 30 minutes as usual. So Bima, as per my knowledge, this is 40-60. 40-60 or 50% in total. So 50 out of 150 out of 300. So Bima, 150 out of 300. So keep it in your mind. You must get at least 50% in the theory. So don't take any chance in the practical. Okay. Hello. Any doubt you can ask me, guys? Any doubt? This completes your today's class. I don't want to waste much time because the time is very precious. We're preparing for your final exam. So that is on 24th. Okay. So yes, come on, guys. Come on. Top palette important. Top palette, maybe a 3 marks question, maybe MCQ as well. So muscles of sap palate, important. So sub palate, very important question. So just go through that. MCQ very commonly asked sub palate. Okay. Sir, MCQ questions fine. MCQ Malini, I think for your batch it is 20. I think 10 will be easy. So as per my knowledge, 20 or 10 will be easy. 10 will be little tough or moderate. So no, hard palate, no, it is not asked. Once cleft lip and cleft palate is asked, okay, not the other questions. Cleft lip and cleft palate asked. Parotid gland asked once. And minor salivary gland, that is basically submandibular salivary gland and sublingual asked once. Question asked about lacrimal apparatus. Okay, one more question. Remember lacrimal apparatus. So that is I know lacrimal apparatus asked once. Embryology, okay. Embryology, you know, important questions. Okay, general embryology, Shashank. Shashank, general embryology, you know, okay, I think we discussed in previous class. Our offline students will answer for sure. Okay, so I think some student asked me, sir, what are the important questions in general embryology? Only asked question embryology. So that is basically law of segregation. Segregation. Previous year question, law of segregation. Comes is your spermatogenesis. Okay, spermatogenesis and oogenesis. Then your blastula, gastrulation, gastrula, formation of germ layers. Okay. Yes, germ layers. Okay, that's very commonly asked. Then I think in one, I think the question asked about mesoderm. So frequently asked question is mesoderm. Mesoderm, especially okay, and intermediate mesoderm, and lateral mesoderm. So this is one important concept as per my knowledge. Mesoderm, especially 5 marks question. What are the derivatives of paroxysmal mesoderm, a classified mesoderm, like that? Yes, neural crest. Yes, yes, very good. Notocard. Sixth one, basically notocard, crest cell, neural crest cell, ectoderm, endoderm can be asked. I think can be asked. Ectoderm, endoderm, neural crest cell. Okay. Okay. So sometime question asked aortic arches. Okay, aortic arches once. Aortic arches. Brachial arch. So there is a overlapping between systemic and general embryology. Okay. Somites. Okay. Any other question? Questions. Then autosomal dominant, basically in genetics, basically. So yeah, middle ear is, yesterday we discussed middle ear contents. Middle ear like a matchbox. It has six six boundaries, and middle ear contents also we discussed yesterday. Very important. So middle ear cavity is very important. Tympanic membrane is also important. So inner ear, no, it is not as till date. Okay. Histology. So histology, I think we discussed Janish in yesterday video. You can just go through that. So heart tube, front of heart, yes, or tetralogy of Fallot. And one of the exam question asked about tracheoesophageal fistula, TEF. I remember, I think in one of the exam question asked about TEF, tracheoesophageal fistula and types. Esophageal fistula, one difficult paper in June 2021. Trunk. We discussed already in previous class. Yes, Shashank, thank you. So now you don't worry about much about the percentage and all. Just keep revising and go through all these important topics. So go with a positive mindset, and don't leave any question in exam. Don't leave any question. So write some related answers, not the story. So some related answer you must write. Okay. So there are high chances of getting passing marks, and there will be extra marks as well. Hmm? Okay. MD Kaif, Shashank, Shashante. Yes, I think rotator cuff. Okay, that's fine. So this is about the today's class, and thank you all. Happy reading. We'll come up with the tomorrow one small session will be there. That is related to examination. So you can write. Yes, most important part. Yeah, most important part. Again, it depends on the position. Okay, supine position and standing position, like that. You can just go through the Chaurasia book. Yes, you can draw diagrams. Definitely, diagrams are very scoring. If you write diagrams, you will get more marks. As per my experience, the first year exam, even my experience, first year exam is one of the most difficult phase of MBBS. So in second year, third year, and final year, there is a carryover system, and but in first year there is no carryover, uh, and uh, and difficult one because anatomy, physio, and biochemistry. So they are actually heavy subjects. They are very vast subject. So it requires a lot of reading, a lot of hard work to understand the concept from the basics. So and all the subjects are very vast. I remember my days, my UG days, first year. So it was very depressing for me, and I was very much stressed that day. So especially before the anatomy exam. So ತುಂಬಾ ಸ್ಟ್ರೆಸ್ ಆಗಿತ್ತು ನನಗೆ ಓದಕ್ಕೆ ಆಗ್ತಿರ್ಲಿಲ್ಲ. ಸೊ ಐ ವಾಸ್ ಅನೇಬಲ್ ಟು ಕಾನ್ಸಂಟ್ರೇಟ್ ಆ್ಯಂಡ್ ಎಕ್ಸಾಮ್ ಟೈಮಲ್ಲಿ ಏನಾಗ್ತಿತ್ತು ಅಂದರೆ ಸೊ ಐ ಯೂಸ್ ಟು ರಿಮೆಂಬರ್ ಅದರ್ ಥಿಂಗ್ಸ್ ಅದರ್ ದ್ಯಾನ್ ಸ್ಟಡೀಸ್. Uh, so many things going on, at the time of examination. You don't worry about that. Just concentrate on the questions, concentrate on the important concepts and important diagrams. Yes. You just keep writing few diagrams, practice. So with the rough pages and all. Like example, blood supply of heart. You can write a label diagram like coronary artery, right and left coronary artery, and the branches and the dominance, coronary sinus. You can draw a diagram. So writing diagram in anatomy is very important. So that's what very important. Okay, abdomen. So was paper 2. Now don't worry. So now it is the time to read a paper 1. So now tomorrow full day just to read a paper 1. So then day after tomorrow there will be 1 day gap. So in that we'll have a discussion. Okay, reels become interesting during exam preparatory time. Yeah, yeah, that is there. That is there. Yes, yes, reels. So you avoid Instagram, avoid Facebook, and all. Okay, so for next few days till your final exam, I think probably that is in somewhere in October 8. I think October 8. Hmm? Just want to ask. Rank. Yes, that is a escape mechanism of a brain. Session. Thank you all. Thank you.